so much after that, so many other researchers were done because people didn't know until Professor Park Jae-woo came up with the concept of Sujok. So when I studied acupressure, it was all about the meridians in the whole body. You know, it's actually the whole body. So the meridians passing from your head all the way down to the toes. And then we have to remember the meridians passing from here, going down to the hands and to the fingers. But Professor Park Jae-woo came up with this concept of Sujok, which is hands and feet. And what he said is that once you know where to press on the hand or the feet, you don't need to undress yourself to get into the meridians. Because say, for example, if I wanted to treat my shoulders, actually the points that I need to do for my shoulders would be in the back. They would be really in the back. Now, for me to reach the area that I want to reach for that point is going to be difficult, right? But if I know the Sujok concept, then I can just pick up my hands. I make sure where my shoulder pain is, and that is how we are going to learn today. That is what the intention is. So let me see. Let me ask these two people if they are going to join. If you guys don't have water, please keep water handy.
Mm-hmm.
That would be nice. Because
Would you give me some water?
And the reason I scheduled the reflexology, 2-day reflexology right now is because anyone who is joining for the Sujok, if you join the reflexology, you will start seeing the similarities of what Sujok does and what reflexology does, because reflexology is another great concept of healing and keeping yourself more healthy. And reflexology is one of the best ways to, even if you don't know Sujok, but if you do proper reflexology on your feet every day or even twice a week, you will start seeing the difference. So at one point, I think it was last year, 2020, very early, I had this couple reflexology class. So I wanted to teach both the spouses so that they can do it on each other, you know, because
that's a good idea.
Yeah. And so if you join reflexology, I would say, like, get volunteers. They would love it. They would love to get reflexology done. Okay, so is anybody else joining? I just want to wait one more minute just because I don't want them to feel that I started a little early.
All right, so 4:29. So
yeah, and it's 30. Okay, let me see if they are having an issue. Oh, come on. Did you click the link? There. Okay, good. Hello. Okay, so one more person. She's having little hard time. 1 second. I don't know why she's looking for a password, but let's see.
It did ask for the password.
It did ask for the password?
Yes.
Is it not
Okay.
for me?
Yeah. Okay, great. Everybody is here. Awesome. So everybody have your hand out, and you guys can unmute yourself. And then we are going to have interactive, so definitely unmute yourself whenever, if you feel there is going to be some disturbance, then you can definitely mute yourself at that point. Okay. So Sharon, it looks like you have all the tools and you're going all ready with everything. That's good. That's
Because of
good.
Suma.
I think, Joni, you should be having the ring too, right?
Yes, I should
Yes.
go get that. Okay.
No, if you want to. Me and Sharon, we were just talking before everybody joined. So
Yes, I have it.
I think most of you should be having the ring. But that's the fun part, right? And then you will know why we are going to use this ring and how it's going to help and what is the reason of all this. So, okay. Thank you, everybody. Good evening. Healthy, smiley evening to all. And we'll start. What we will do is, before we go look into the handout or I share my screen, I just wanted to share this, that Professor Park Jae-woo, he was a Korean professor, and he actually discovered this advanced technique of acupressure. So initially, acupressure started with zone therapy. Went from zone therapy, it started going into reflexology, and then it all started to combine, and then acupressure was always part of acupuncture. Acupuncture would be with needles, acupressure would be with pressure points. But when you do acupressure, if I have pain anywhere in, say if I have pain here, then I'm fine touching my head and giving pressure and I can relieve. But if I have pain in the back or in my shoulders, and if I have to reach those points for acupressure technique or concept, it would be too difficult or I would need someone's help. So Professor Park Jae-woo came up with this Sujok Therapy, which is Su means hands, Jok means feet. And what he decided is that if you just treat your hands and feet, you can still treat. So what I'm going to talk about a little bit today is all about how the Sujok works. Why does it work? And then there is much more in it. What today I'm going to show you is how you can help yourself, your family, or friends, or anybody, if you know the concept of Sujok therapy. Then you will be able to help a lot more than you think. There is more deeper. There is German concept of acupressure, and there is Ayurvedic concept of acupressure, and you know, there is so much combination that is there if you want to treat any complex ailment. Say, for example, I want to treat someone who's having first stage cancer, then I need to know a little bit more deeper, more than the Sujok, this basic level. I need to go up to the 4th or the 5th level. And there is a German concept where I can help even to fix the fractures, like, you know, hairline fractures that is in your rib, or you have a fracture that is somewhere in your body that is not healing. I can help with magnet therapy, but those are very high level where you need to go step by step to understand. Of course, it involves a lot of anatomy of the body, understanding what happens, why it happens, which organs are affected, and so on. But today what we are going to do is we are going to do it like a layman's language, very easy to understand Sujok. And so if you guys can just take your printouts, and I will share my screen so we can have it together. Okay, share, and let me share. Not this one. I want to go. Not this one. Hang on. Oh, there. So Okay, so I'll go to the next screen, which is this. So here I have explained a little bit what Sujok is, who discovered it, why it is safe to use. It is 100% safe therapy versus acupuncture. The reason acupuncture is not always safe is because if the acupuncturist is not inserting the needle in the right point to the very precise point that is needed, or if they don't know the depth of the needle, or if they don't know the size of the needle they should be using in that particular area, and when they are stimulating it with electrodes attached, you may get bruises, you may get more pain, you may get more pain in some other areas. So acupressure is considered one of the safest, and Sujok is 100% safe. The reason is we are only using it in our hands and feet. There is nothing that you're going to do wrong. And if and in case you feel that, oh, it is because I did this and that happened, it's going to die in a couple minutes. You start rubbing your hands, like Sharon is rolling, with the roller, you start rolling and you just massage the area, everything will be fine. It's all basically about the circulation. So here, when we look at this chart, as you all see, what is happening is we are given the organs that correspond on our hands. So now if you see here that if I'm holding my hand, I'm holding it this way, right? If I'm holding my hand, it's going to be this part is my brain, as you see, right? The tip of the thumb is shown as the brain. So whenever, if someone has pain in their head, so I'm going to use this so I can flip it this way and I can flip it this way, okay? So if I want to hold it the way the figure is, so if I am pressing this tip of the thumb here, and if I have pain somewhere around my brain, when I'm talking about brain, you might have headache. Headache is what? Anything that something is going on in your brain. Now, brain also has 4 lobes, right? The temporal lobe, the occipital lobe, the parietal lobe, the frontal lobe. All these lobes are there. And in one of the lobes, there is pain or circulation issue. And that's why you're getting the pain. So any kind of pain, all you have to do is start massaging the tip of the thumb. And that will start helping. You will start seeing that the person will start feeling like they start feeling relaxed in a little bit. Now, if I go, I don't know if I give you the yin and yang side of it. So if you want to also have your plain hands that I have sent, I think I sent you cutouts for empty hands. So you can either write down on the yin side or on the yang side. When I say yin side, it is the front of our hand. Okay. The yang side means the back of our hands. Okay. So right now, I'm going to go through this, and once we go through the slides, I'm going to start showing you what all we can do and why it works. So here we are seeing that the lungs, if you see the lungs, do you see one side of the lung is here, but the other side of the lung goes here, correspondence, right? So if you are looking at this hand, and if I want to show you the lung, so one lung will be here and the other lung will be on this side, just like the breasts, right? So now if you go from the brain, if you go down, you see the eyes. The eyes are here. So usually when I am showing it to people, you can take your thumb, or if you want, you can do it on your paper. It's up to you. my eyes. So you know where your eyes are. Okay. See, there is this protruding part on your thumb. You see it?
Mm-hmm.
So that protruding part is your nose. Okay. Now, how do we come down? Do you see that there is this nose, then there is this mouth. So the mouth is do you see it? Is it clear?
Yes.
Okay. So now you see why they showed here, they're showing just the lips, but actually if they're showing it, they're showing the whole mouth. Now, when we go deeper into learning, understanding more Sujok, there is more about the teeth where you can help around here. And I will talk about it later once I have explained a little bit. Now, here is your heart. So when you go look at your lungs, you see the lungs, and then right here in the center. So here is one lung, here is your second lung, and little towards the left is your heart, right?
Mm-hmm.
So if you take your hand, if you want to do it on your hand, what you're going to do is take the center point from the joint of your thumb and draw a straight line. So it becomes half. Okay. Now you will see one side is your lung and the other side is your lung, and to your left side. And how do you draw the left side? I will show you 1 second. So if I do this way, do you see a question mark on my? Do you see a question mark? Let me do it on the hand and show you. So if this is my hand, okay, I'm holding it like this. Do you see the question mark on it?
Oh, yeah.
Yes.
Okay. So you see the question mark. So this part of the question mark is your left side. So now when you have your one lung here, one lung here, your heart is going to be more towards this side, right? Okay. Then this is what I have drawn is the stomach. If you look at the stomach area, do you see how it is?
Mm-hmm.
Right? So it's like a question mark, right? So it's right here actually coming. So if I also look at it, it's coming towards the thumb, correct? The curve is coming towards the thumb. Towards your thumb. It should be towards your thumb. Okay, so that's your stomach. Then you have your pancreas close to the stomach because the pancreas is more attached closer to the stomach, right? And then also the spleen is more closer to the stomach. Now, pancreas, spleen, they are small organs, so it's very difficult to actually pinpoint them. But if you know around where it is, then it's easy when you're treating. Now, this side of your hand is the liver. So if I want to just draw this, make it into a triangle of this hand, this is going to be my liver. Okay. And then on the liver, one side is gallbladder that you can see. It's a teeny tiny gallbladder. Now the kidneys, they're showing it here, right? But actually, where are our kidneys? Our kidneys are actually in the back. You're right.
Right.
Right. So the point shown here is not wrong, because if you press it here, you're also going to automatically press here. Do you see? Like, see, my hand goes here, but then see my finger goes here. So when you want to locate your kidneys, you hold your hands like this. And this part, this is where one kidney will be. And this is where your second kidney will be. Okay. So if I'm holding this, right here will be one kidney, here will be the second. Can you see it easily?
Yes.
Okay. And then all this center part is all both your intestines. Okay. The large intestine and the small intestine. And here is your bladder. Right here between, like you separate your fingers like this, sorry. And this will be your bladder. Okay. Now you will see your ovaries and uterus right below the bladder. Okay. So this is a little bit of mapping, and this helps if you, right now I have shown you, we'll discuss it more. And the same way is in the feet, right? The only part what happens is this area of the feet is longer versus this area becomes shorter, right? Because now from here you count the toes and then you find the feet, but everything else is going to still stay the same. Okay. Now, and it will be interesting once I start showing you how it corresponds. So this is the slide where you see the correspondence. And what I have done here is, say for example, we have if I have this, but if I take this thumb and I place it like this, now this becomes my head, right? Do you guys understand?
Yeah.
So that is what this slide is telling us about. So this is your hand, but if you imagine that the thumb is going up, then this thumb is becoming your head, right? So once it becomes your head, so your thumb goes up and everything else goes down, just like the way we stand. And it is shown here, right? So these two are going to become your hands, the last two fingers. So this and this becomes your hands. And that's why all the diagrams are shown like this, because we are imagining our body on the hand as if we are standing. So it will be easy for you to locate what you want to locate, right? If I show you like this, we don't sit like this, right? We don't sit like this. We sit like this, right? We have to stand like this, I mean, right? So now these two are our hands and these two are our feet, which is shown here, like you see. A is your head right here, okay? B is your hand, this hand, and of course this hand. So B, what they have done here is they are showing the right side and the left side. So this side, which is the left side, is the B, if you're, because it's the left finger, it's the left hand they are showing, right? If you hold it like this, this is your left hand, right? Everybody is with me?
Yes.
Okay. So now you have this left and right. Now you know this is your left hand and the left leg, and this is your right hand and your right leg. So far, so good?
Yes.
Okay. So now, if we go down, now comes all these areas that actually is helpful for you to keep as a reference. Now here they have also shown us the yang side and the yin side. When I say yin, it is the front. So in the front, what do we have? We have all our organs, the intestines, the stomach, the liver. We have the gallbladder. We have our lungs, right? When you go to the yang side, which is the back side of your hand, what do we see? What do we have in the back? Nothing but spine, right? We don't see much of anything but spine. But at the same time, remember that the kidneys are always going to come here. Because this is the basic, but I want you to know this because kidney plays a very important role. And I'm going to show you how to keep your kidneys strong and healthy. So I'm going to tell you this is where the kidneys come. Okay. So these are the diagrams that you can see. I'll explain this just in a minute. So now that if you see 1 is 1, 2 is the neck, you see here, 3 is the chest, you see here. So Joni, you know, a lot of times that when you come, you ask, right? How can it help? Like you're pressing here, but I feel here. So now this diagram will help you understand why this is happening, okay? So the 5 here is 5 here. Can anybody tell me why why 5 is in this finger or this toe? And why 11 is in this toe and this finger? Anybody?
Because it coincides with your arms.
Yes,
Those 2 toes are your arms and the other 2 toes are your legs.
correct. Like
Correct.
we just saw in the above. I'm going to start keeping some awards so we all will get stars when everybody answers.
Dang, Joni got the first star.
So like we just mentioned, right, that these are going to be our arms, right? That's the reason why 5 is here. Your right arm is right here. Your left arm is right here. Easy now to
Yeah.
understand and relate a little bit. So you can go through the rest, right? The 4 is here. So anything that is below your diaphragm and above the lower limbs, it's
Left.
all going to be your 4. So this is all coming in here. Okay, your intestines, your stomach, they all come here. Okay, or here. Now you see 3 is here, chest. Do you see? Like we already mentioned, right? The heart, the lungs are going to be here. Correct?
Yes.
And the 2 is the neck. So anything related to the neck, you're going to treat this area. Okay, and then the same thing they have shown it with the diagram. So here do you see the occipital bone? So they have shown you where it is in the yang side of your thumb. So many people, when you press this, it is painful. Can you see here? Like right above your knuckle, like below your nail, just above the knuckle. If you press, most of us get some pain because this is our stress area, and also our whole part of this head rests on the rest of the spine, right?
Yes.
Okay, and then this is your C-spine, and then your thoracic spine, right? Do you see this? And then it goes, and then if you see, think about this thumb being flipped like this. This thumb goes up, so then you know. Do you see now how this ends here?
Mm-hmm.
So all your thoracic up here, and then it starts with the lumbar going down into the sacral. Yeah?
Yes.
Okay. And the same way here, when we understand if this thumb, we take it up here, so we know that this lungs are going to be here, and then the heart, and then everything else, and then it goes downwards, right?
Cool.
Okay, so far so good.
Yes.
Everybody up? Okay, great. So now you guys might be wondering, what is this, right? So this is actually the next level where you have to understand the insect level, the mini system of the Sujok, meaning within your finger, again, you can find the body parts, you can find each area of your hands, just like we found in the full hand. Then you can start finding, these are your legs, this is your hand. And if you can figure out, the first phalanges will be your whole hand. And in that mini system, you're going to find the thumb, you're going to find yours, your lungs, your heart, then you're going to find the left hand, the right hand, then the legs, and you're going to find the stomach and all the other areas below the diaphragm. Okay, so that is what this is telling about. But it's given here because if you want to further understand it, it is not that difficult if you have understood the basic of Sujok. So first only practice the basic. So now I have told you the yang and the yin side of it. Remember,
Mm-hmm.
we separated, right? We put our body into half. Now we know this right side 2 and 3 is going to be, do you see this?
Yes.
Okay, so this is how the yin side of your body is separated, and then the yang side of the body is separated. So when we are coming to the foot, what happens is this area that we are working on is actually the back of, it's your back, right? But if I want to work on your stomach and everything, then I'm going to go over here. Okay. And then on this one, everything is given within the finger, like I said. Okay, so this whole finger can give you the whole Sujok concept. If you want to just work on one finger, and if I am working on that one finger, what I'm going to do, I'm going to take this finger, this is my head, eyes, nose, and this is the mouth, here's my neck, and then the chest area, and then the upper abdominal, and then the lower part. So here sits all my what do you call, the stomach and the large intestine, and everything will be here. So when I have to make you understand, if I take my finger, I'm taking this one finger. Now this is, instead of the full hand, I'm going to go here. I'm going to draw my eyes, my nose, my mouth. This is my neck. And then here is my lungs, my heart, and then here is my stomach and the large intestine and everything. So my whole body is covered in one finger.
But so I don't understand how that finger could either be your arm or your whole body.
No, so that is why you have to first understand the first concept. The first concept is all about understanding the whole body in this hand.
Right. So the finger was an arm, represented an arm.
So right now, when you're taking the whole hand, this finger is your arm.
Right.
But if I want to just find one, I don't say, for example, hypothetically, we are talking, I don't have one hand. I have one hand only. Okay. And I don't have all my fingers. My half fingers are cut. My one finger is there. And I want to treat this person through Sujok. Now, if I know the whole body is here, the way I'm going to do is, this is my whole body, right? This is my whole body. Now, if I want to find the fingers on this body, then I will have, there is another way of looking at it. If the fingers will go here, the arms and the feet will go here in the side. In the side.
So you're saying our finger can be both an arm, or if you're treating just focusing on the finger, you can treat different parts of your body by just using your finger.
Yes. Yes. So when you're treating the arm, you will treat this part of the body. When you're treating the leg in the finger, you're going to treat this part of the body, and that will be your right and left. You have to imagine this is the finger, and these are my arms, and the other one is my leg. Let me see if I can find that over here and show you guys. It's called the insect system of Sujok. And in the insect system, what you do is, there you go. This is the insect system, and this is what you see. If you guys want to take a screenshot of that, that's fine. So now you see what I was talking about, that this is your arms, and these are your legs. And the last phalange is your lower abdomen. The middle phalange is going to be your lungs and your heart. The top phalange is going to be your face. Okay. Oh, come on. I want to come back to. Okay. I'm going to just stop sharing, okay? So that I can come back to the shared screen later. But did you guys understand?
Yes, the basic concept I understood.
Okay. Okay. So just so that when everybody is, if you are listening to me, if you want to mute yourself, that's fine. So everybody will not get the disturbance. But any question, then I'm going to show you what we can do based on what I showed. Any questions, or should I show you?
I think I got it.
Okay, good. Okay, so now if I am saying that I have pain in my eyes, my eyes are hurting, what are we going to do?
The thumb.
Where?
Here on the front of the thumb.
Front of the thumb. Yes, yes, yes. Everybody is right. So good. So you're going to take something that is not too sharp, little blunt, and you're going to make sure that you are giving a good pressure point here. So even if you have conjunctivitis, trust me, you can help yourselves, okay? By just pressure pointing here. The second thing is, I don't know, some ruffling noise is coming. I don't know from where, but I hope it's not my computer. Okay. So normally what I do is I'm going to show it. Say I'm having a throat pain. How about that?
A
If
little
I'm
further
having
down
throat
on
pain,
the thumb.
where?
A little further down on the thumb.
So you're going to go on this joint. That's going to be your throat. Yes, nice. Ask me when even you have the roller. Very nice. Good. So you're going here, right? Now I'll show you another way. And that is, how long can you keep massaging? Right? So what would you do? So you take a tape, and I put fenugreek seeds on this. Okay. I took a tape. I lined up fenugreek seeds on this. I'm going to go on my corresponding area of the neck, and I put the seeds over here. Now what happens? Now on and off, I'm always going to press this. This is going to give more acupressure to the area that I need help with. And that way we are going to start using the seed therapy. So in Sujok, the best way is seed therapy. Yes, your ring is also very helpful. The Sujok ring is very helpful. I understand. But even with the Sujok ring, there are people who they keep on doing the Sujok ring, but you can't do more than 5 to 10 times at a time, right? Sometimes some people will also get rashes, or they'll start getting blisters because this is sharp. If you keep on rubbing, and if your skin is a little delicate, you're going to have that issue of getting blisters or redness or pain, and then you won't be able to touch that area. So doing the Sujok ring is good because this stimulates the overall circulation in the body. Why this will circulate, do the circulation, stimulate the circulation? Now you know why. When I'm doing the thumb, what am I doing?
The head and the neck.
Everything, right? The head, the mouth, the neck, right? I'm going down further, this part of my neck also, right? And then if I'm going on this finger, what am I doing?
An
When
arm.
I am massaging my arm. Asmiben, if you're saying something, I can't hear you. You're on mute.
I was just like repeating arm.
Arm. Okay. Okay. Good. Good. Okay. So now when you go to these two fingers, this and this, two fingers, now what you're massaging?
Legs.
You're massaging your
Legs.
legs, right? And
Mhm.
when you do this little finger, you're again massaging another arm, right? So
Yeah.
actually using you're having the ring also. Very good.
Yeah. So is this the right leg? This is the right leg and this is the
Okay.
left, right?
Yes. So if you're taking your left hand and you're holding it like this, your thumb is going like this, right? So if imagine this going upside down, then which is your right and which is your left?
Oh, I see. So this is my right and this is my left, right?
Correct. Correct.
Okay.
So in the same way, when you go, you take this hand, if it's your right hand, just imagine this part going down and you're holding upside down like this because your head is up. Then you have to figure out which is your right and left. So again, towards your thumb will be your right. So if you're holding your right hand and your thumb is like this towards your thumb. This is your right hand and your right leg. This is your left and your left leg. The simplest way is if you're holding the thumb, towards your thumb is the hand that you're holding. So if I'm putting this up and this is my left hand, so these two are my left arm and leg. This is my right arm and leg. If I'm holding my right hand, this is my right arm and leg. This is my left arm and leg.
Okay.
Right? Got it?
Yes.
Okay. So now you know when we do the stimulation with the ring, why it helps, correct? In the same way, many times when I tell that do the roller, you know, keep rolling, do this here. Why? What happens? We're stimulating our every organ in the body, right? The intestines, the uterus for ladies, the urinary bladder. We are stimulating each and every part. The lungs, we're stimulating small intestine, stomach, gallbladder. Everything is being stimulated. Now, a lot of times, some of my clients ask that, oh, my gallbladder has been removed. I don't think I need to work on my gallbladder. Yes, your gallbladder has been removed, but the meridians that are connected with the gallbladder and the meridians that interact with the other organs in the body is not disconnected yet, right? So that's the reason why you need to continue doing what you need to do, because if any of you think of studying further in Sujok and you want to understand what is the gallbladder points, what are the urinary bladder points, and what are these meridians. So all these meridians pass through here. Every meridian passes through here. But right now, the basic that we are learning is the organs and how to correspond any of these pain points. So if I say if whoever attended the COVID-19 class, I was saying that the lungs needs to get more stronger, right? What are we going to do? If I wanted to treat my lungs with just basic Sujok, where would you treat? Yes. Now, what kind of treatment can we do for the lungs? So we can again do the same thing. We can take a tape, put a cluster of fenugreek seeds, and you can apply it here. But I want to show you different seeds that we can use. So here I'm using green lentils. With the green lentils, what you need to make sure is, do you see all the white part is up?
Mhm.
So the white part of that green lentil should touch the skin. Okay. So usually if I am taking this green lentils, and I can use it any kind of seeds anywhere. There is nothing that you can only use this here and there. So now say, for example, I am having severe pain in my shoulder joint here. And where will be our shoulder joint now? Your shoulder joint will be there, right? Fatima ji, that is where it will be, yes. So it will be either on this one, depending on the hand, that arm that is hurting, or it will be this. Now say I'm thinking of my right, because my right arm is hurting. So I'm going to take this and I'm going to apply it on here. Okay. Can you see it?
Uh-huh.
Okay.
Yeah,
Okay.
right.
Okay. So here another thing I will tell you, which a lot of times they don't tell you and they forget, is when you're looking at your shoulders, your shoulder joints go up to here, up to the bone level. The bone. So a lot of times if you press here and you're not feeling any good, remember to massage this area And if you find any pain points around here, and you put a seed there on the pain point. Okay, so the way you're going to do is, once you know, say for example, I am having pain in my ankle. Okay, my ankle is hurting. Now where do I go? Yes, yes. So we all know that now the ankle, we are not going here, right? Because this is your thighs. We are going here, this joint. We are going to this joints. Now, how do I know where to apply the seed?
Where it hurts.
Right. So what you're going to do is you're going to massage the area. Say if it is your left ankle, you're going to massage the finger that is corresponding to your left ankle, right? You massage it. Then with something blunt like this, don't take anything pointed. You're going to just start pressing around. Okay, when I say around, it is around. Why? Because even here is your leg, right? If I draw, this is your leg, right? This is going to be the ankle. So you are going to press around where you might find 1 point, you might find 3 points, you might find the whole joint is very painful. If the whole joint is painful, just like I did here, you put it around, line up the fenugreek seeds. Fenugreek seeds are easy to do, and they are having more energy. They work faster. High energy is in there. Or you can take 1 lentil, 2 lentils, whichever, and you can put it on that painful area. Okay, you can put 1 fenugreek seed, 1 lentil, whatever you like, whichever is handy. If nothing is handy, and say you went camping and you want to help someone, you don't have seeds over there, what are you going to do?
A rock.
Yes, find a teeny tiny pebble or take a branch, cut it into a small piece and put it on the area that it's hurting. What is our intention right here is to stimulate that area to give itself acupressure so that that meridian starts to work. Okay. Okay. Now, if I'm having back pain, most of the people I get is back pain, right? Many of us, because nowadays everything is sitting on front of the computer and you're doing stuff. So you're going to have back pain. Where would you put your seeds, or where would you rub?
On the back of your hand.
Correct. Yes. Where? Correct. And Fatima ji, little up. You will go on the young side. Young side. Yes. Yes. So everything here is going to be your back. Okay. You're going to rub and see which area is more painful. If you find a painful area, for the back, I take dry peas. It can be green or white, whatever you have. Okay. And I will find my pain point and I just put my seed here. So what happens is whenever I'm feeling pain, I'm just pressing this, right? Now, when you do this treatments, if you do it at night, it's more helpful because you're not going to get up to wash your hands. The seeds will stay there. It'll do its part. You're going to twist and turn. It'll still get some pressure. So by the time you get up in the morning, it has got enough stimulation for you to feel much better. Okay. If you have
You cannot use fenugreek for the back?
You can use fenugreek, but then you may not want to use it like a one line. You might want to make it like cluster of it. So then you can put around and press it nicely. You can use any seeds anywhere. I say mutter seeds, or sorry, the dry peas, most of the time is, if any of you keep going, there are other ways where there are other points in the wrist area. So if you put those points here, it can also help tremors. It can help severe back pains. It can help severe health conditions, which is with the brain related. And that's why in the beginning I said that there is now the German concept, which I was not aware of. So I just started studying the German concept and the Ayurvedic concept, where it is not difficult for me to learn, because I already know the basic concept of everything that I am doing. But it also gave me an insight that there is more ways to treat complex ailments. So of course, people are doing more and more research on different things. And, there are people who are volunteers ready to help, ready to try out these therapies. And that's why it's helping. Of course, there is magnets that we use eventually. But when when you're doing basic Sujok, you always work with the seeds, which is which is the safest. Okay. So the back, again, yes, you can use this fenugreek seeds. Hands and legs, now we know, right? Now, where is the knee? Knee, again, there is a lot of people who have knee problem. No, Fatima ji, that's your back. Where is your feet? Where is your feet? Yes, so these two are your legs. So when these two are your legs, you go like this. This is your ankle. So the middle joint will be your knee. And most of the time, the knee is always painful when you touch in the sides of these joints. You pressure it and you massage it. You will find, if your knees are weaker, you will definitely find some painful areas. And you can put fenugreek seeds there too. Okay. So for your nose, like now, right now, almost winter is going to go away, but you can use black pepper seeds, and you can put it on that corresponding nose area. That also works wonders. So my
Smita, I
daughter
have to
does
leave
that.
now.
Yeah.
Sorry about that. I have to leave now.
Yes. Yes.
See you later then.
Okay. Thank you for
Bye-bye.
joining.
Bye-bye.
Yes. Bye.
Bye. Bye, Fatima ji.
Bye.
Okay. So, any other question? I wanted to show the kidney points. Oh man, I forgot to show her. It's okay. So for the kidneys, you take kidney beans. You see how these two mouth of the kidney beans are facing each other, and they're shaped as kidneys too, right?
Yes.
Now, how are you? I have told you how to find the kidney points. 1, 2, right? So one will be here, one will be here, and they should be facing each other. You should do this point once in a week, because if you are overworking, you're going through stress or anything, your kidneys and your liver affect the most. And because the kidneys and liver get affected, your heart is also going to get affected. So you must, once in a week, you should just apply it bilateral, both hands. You should apply the kidney beans at night, and you should be at least helping it a little bit to stimulate itself and balance out. Actually, I want to share one thing. I had a patient, a client. She was very young. She has kidney problems. She had gone to the doctor. Everything was fine, but somehow she felt that it was still not up 100%. And so she came to me because she said that maybe this will help. All I did to her was reflexology and this point. In 2 sittings, she was like, I don't know how I can tell you, but I completely feel okay now. Just doing these points. I do reflexology anyways because I want to stimulate all the organs. So I just don't do Sujok therapy. I always do reflexology with it. So I get really better results. I feel that's why. So if this is what I would do. Okay.
I have a friend with really bad tremors. She has a brain injury. So you said that is down by the wrist?
Yes, but and that one I will not, because it is done with magnets and strong magnets. So that part I will not teach because it is something that it has to be understood before anything is done in the
So
brain area.
you can help that? You've seen
Yes.
good luck with
Yes.
that? Wow.
Yes. Yes. But if it is brain area on her left hand, left wrist, she can put 5 dried peas on the left wrist in the front, 5 in the back, and she can see if she's feeling the difference, then she can definitely contact me.
Okay.
So with the seeds, I am okay with them trying. I'm not going to give anything with other than that. This is just to try it out. If she feels better. Yeah. Okay. Any other question? I don't think I have missed anything. I wanted to show you guys how to apply the seeds, why you should be applying the seeds. We cannot be always giving pressure points, but always do a little bit massage before you apply any seeds, and find the pain points, and then you can always put the seed in that area.
Do you have anything special for tinnitus? I know it would be on your thumb, but is there a particular seed or color that would be the best?
Fenugreek seed should work the best for it.
Okay.
You can try putting that every day. So when you are looking at this, see where our eyes are, our ears are here, right? So our eyes are here, so our ears are going to be right here, right? So you can take that, do the pressure points, and you can put fenugreek seeds around. So you can put the fenugreek seeds around.
Is there a color for color therapy that would work as well? I feel like I would do that more than the seeds.
You can try the black color for now. Yeah. Yeah. So you can just do the black on the sides where the ear correspondence is.
Okay. Thank you.
You're welcome. Any other question? Any feedback,
This was
guys?
good. This was good.
Good information.
Thank you. Very good.
Good. I'm glad. This is totally a basic, just an introduction to Sujok. So definitely there is a lot more to understand and to know more further and further. If anybody is interested, I would not mind going a little bit more further for the next level. But I know that a lot of people just want to understand the basic of Sujok, and that's why I had it. And then, as you all might have also received, there is one free session that is coming up for diet, Eat Right for the Heart. The dietitian cannot come other than 11 o'clock on Wednesday. So it's at 11 o'clock on Wednesday. I'll be sending the link if you would like to. The only thing is, the reason I have every one of you joining and registering every time is because that's the way we know for this particular event you want to join, so we can let you in. Because last time with the Sujok, fortunately or unfortunately, we had technical issues, but I had 200 people who wanted to join, but none of them wanted to pay. So, so I was like, I cannot let you in just because you registered, you know. So now on, I'm going to send that link. I'm trying to upgrade my website, so it will be all through my website instead of going through other situations. So thank you for being patient with me. Thank you for going through all the pain that I'm having, and I'm giving you guys the pain too. But
No,
thank
this
you.
was good. It's okay.
This was very good.
Thank you
Good,
very
great.
much.
Thank you.
Thank
Thanks
you.
for joining.